Hi friends, welcome to a very important presentation on normal eye movements. It is very important to know the different terminologies that we use to describe the eye movements. We will try to understand what are the different extraocular muscles which are responsible for eye movements and what are their nerve supplies, what are the different position of gaze, what are the laws governing the various ocular movements. I hope at the end of this presentation you will have a very clear idea about the various eye movements. It's very important to know this as you will come across the abnormalities in the eye movements when you are working in wards or emergency department or in any specialty for that matter, because majority of the cranial nerves supply the eyes. Let us begin with the understanding of the various extraocular muscles and the nerves. The ocular muscles can be divided into extraocular muscles which are present outside the eye globe and intraocular muscles which are within the eye. So we are discussing only the extraocular muscles at the moment. Each eye has got four recti muscles, that is superior rectus, inferior rectus, medial rectus, lateral rectus, two obliques, that is superior oblique, inferior oblique, and one levator palpebrae superioris. Third cranial nerve, that is the oculomotor nerve, supplies most of the extraocular muscles except the lateral rectus, which is supplied by the sixth cranial nerve, which is abducent nerve, and the superior oblique is supplied by the fourth cranial nerve, which is trochlear nerve. The fifth, the trigeminal nerve and the facial nerve are also involved with the nerve supply of the eye. What are the actions of these extraocular muscles? Lateral rectus is responsible for abduction, that is movement of the eye outwards. Medial rectus is responsible for adduction, which is inward movement of the eye. Similarly, levator palpebrae superioris is responsible for elevation of the lid. Superior rectus is responsible for elevation, whereas superior oblique is responsible for depression, that is lowering the globe. Inferior rectus is responsible for depression, that is lowering the globe, whereas inferior oblique is responsible for elevation of the globe. Superiors are intorters, that is both superior rectus and superior oblique move the eye inwards, whereas inferiors are extorters, that is inferior rectus and inferior oblique rotate the globe outwards. The superior and inferior recti are adductors, whereas superior and inferior obliques are abductors. It is very important to remember all these because they will help us to diagnose the cranial nerve palsies. We describe the position of eyes in terms of primary, secondary, and tertiary position of gaze. Primary position of gaze means the position of the eyes with the individual looking straight ahead at a distant object with accommodation relaxed. There are four secondary position of gaze, that is when the patient or the person is looking upwards, that is elevation, that is one position of gaze. Similarly, depression when both the eyes are looking down, that is secondary position of gaze. Similarly, dextroversion, dextro means right, version is just a binocular movement. So when the person is looking to the right, that is dextroversion, and when the person is looking to the left, that is called as leoversion. So the secondary position of gaze are elevation, depression, dextroversion, and leoversion. The tertiary position of gaze, again, these are described as dextro elevation, dextro depression, leo elevation, leo depression, dextro cyclotorsion, leo cyclotorsion. Dextro elevation means, dextro means to the right, elevation means up. So up and to the right is dextro elevation. Similarly, down and to the right is dextro depression. Leo elevation means up and to the left. Leo depression means down and to the left. What are ductions? Ductions are monocular movements, that is, movement of one eye. As we discussed, adduction is movement of the eye nasally, that is towards the nose. Abduction is the movement of the eye temporally, that is towards the outer corner of the eye. Elevation is the movement of the eye upwards. Depression is the movement of the eye downwards. Intorsion means the limbus rotates inwards, and extorsion is rotation of the limbus outwards. So these are 6 duction movements. What are versions? Versions are conjugate bilateral movements, that is, the two eyes moving together in a particular direction. For example, dextroversion. Dextro means right. So when the person is looking to the right side, the right eye and the left eye move towards the right side, that is dextroversion. Leoversion means both the eyes are looking to the left side. Elevation means both the eyes are looking up. Depression means both the eyes are looking down. Let us try to understand these terminologies with an example. Dextroversion means dextro is right, version is binocular movement. So movement of both the eyes to the right. What are the muscles that bring about this movement? So when the person is looking to the right side, the right eye is moving towards the outer corner, that is right abduction, and the muscle responsible for abduction is lateral rectus. Similarly, the left eye is moving towards the nose, that is, it is doing adduction, and the muscle responsible for it is medial rectus. So in dextroversion, it is the right lateral rectus and the left medial rectus which work together. Leoversion, that is the movement of both the eyes towards the left. So which are the muscles which are involved in it? The left eye is moving to the outer corner, so it is the left abduction, hence it is left lateral rectus. And the right eye is moving towards medial side, that is towards the nose, so it is right adduction, and the muscle responsible is right medial rectus. Dextro elevation, that is elevation to the right, that is up and to the right. So what are the muscles that are responsible for this? So what is happening here is the right eye is moving up and to the out, and the muscle that is responsible for this is right superior rectus, and the left eye is moving up and towards the nose. The muscle responsible for this movement is left inferior oblique. So the muscles that are responsible for dextro elevation are right superior rectus and left inferior oblique. The reason for this is the recti act as elevators in abducted position, whereas obliques work as elevators in adducted position. That's why you get the superior rectus and inferior oblique working together. Dextrodepression, that is movement of the eye down and to the right. The muscles responsible for it are right inferior rectus, because the right eye is moving down in abducted position, so it is inferior rectus. Similarly, the left eye is moving down and towards the nose, hence the obliques work in adducted position, so it is left superior oblique. Leoversion, that is movement to the left. The muscles responsible are left lateral rectus, because the left eye is moving to the left, and right medial rectus, because the right eye is moving towards the nose. Leo elevation. Leo means to the left, elevation is up, so that is up and to the left. So the muscles that are responsible are the left eye is moving out and up and left, so that will be left superior rectus. Similarly, the right eye is moving up and towards the nose, so it is right inferior oblique. It must be oblique, not the rectus. Leodepression, that is movement of the eyes to the left and to the down. The muscles that are responsible are left inferior rectus, because the left eye is moving down in abducted position, whereas in the right eye, because it is moving towards the nose and down, it is right superior oblique. Elevation, very simple, it is the movement of both the eyes upwards. The muscles that are responsible are both superior recti. Even both inferior obliques do cause elevation, but the elevation caused by the obliques is a secondary action. Depression is the movement of both the eyes downwards, and it is caused by both the inferior recti. So far we discussed ductions, which are uniocular movements, and vergence, which are conjugate binocular movements, that is two eyes moving in the same direction. Now the next type of ocular movement is vergence, which are simultaneous binocular disconjugate movements, that is both the eyes move in opposite directions. For example, both the eyes moving outwards, that is right eye is moving outwards and left eye is moving outwards as well, that is called as divergence. Whereas if both the eyes are moving towards each other, that is they are moving towards the nose, that is called as convergence, that is binocular simultaneous inward movement of the eyes, as you can see in the picture. Divergence is simultaneous binocular outward movement of both the eyes. As you can see in the picture, both the eyes are moving outwards. Another terminology that we use to describe the eyes in primary position is orthotropia or orthophoria, that is the eyes are looking straight ahead in primary position. When it is not, then it is called as squint. Esotropia. Esotropia is inward movement of one eye while the other eye is looking in primary position. So you can see in the diagram, the right eye is moving inwards, whereas the left eye is looking straight ahead. So that is a squint, and the type of squint is esotropia, when one eye is moved inwards and the other eye is looking straight ahead. This can be for distance, or it can be for near, or it can be both for distance and near. The picture that is shown in this slide is right esotropia, because the right eye is moved inwards. Exotropia, that is outward movement of one eye while the other eye is looking straight ahead in primary position. If you look at this picture, here the right eye is moved outwards whereas the left eye is looking straight ahead. So again, this is a type of a squint and we call it as exotropia. Hypertropia. Hyper means up. So when the person is looking straight ahead, one eye will be deviated upwards while the other is looking straight ahead. That is called as hypertropia. In this picture, the right eye is deviated up and the left eye is looking straight ahead. That is right hypertropia. Hypertropia is when one eye is looking down while the other is looking straight ahead. In this picture, the right eye is moved down and the left is looking straight ahead. Though the eye itself in the picture is shown to be on the same levels, the red arrow indicates that the eye needs to go down to say it as right hypertropia. Few more terminologies that we use to describe the eye movements are agonist, antagonist, yoke muscles. Agonist means a muscle in the same eye which moves the eye in the same direction. For example, agonist for the right superior rectus is right inferior oblique. That is, the action of the superior rectus is to cause elevation. And you may remember I told the inferior oblique as well causes elevation. So both are agonist. Similarly, antagonist are the muscles in the same eye which move the eye in opposite directions. The best example is right medial rectus and right lateral rectus. The action of medial rectus is to move the eye inwards, whereas the action of the lateral rectus is to move the eye outwards. Another terminology is yoke muscles. Yoke muscles are the muscles of the two eyes which move the eye in same direction. Say for example, in dextroversion where the person is looking to the right, or say for example that has been given here is leoversion where the eyes are looking to the left. When the eyes are looking to the left, left eye is moving out, so the muscle responsible is left lateral rectus. Similarly, the right eye needs to move towards the nose so that the person looks to the left. So the muscle responsible in right eye is right medial rectus. So the left lateral rectus and the right medial rectus are yoke muscles for leoversion. Two important laws which govern the ocular movements are Hering's law of equal innervation and Sherrington's law of reciprocal innervation. They are very easy and simple to understand. The Hering's law of equal innervation says equal and simultaneous innervation to the yoke muscles during the conjugate eye movements takes place. That is, say for example in this diagram, when the person is looking to the right, that is right or that is dextroversion, what is happening here is the right lateral rectus is moving and the left medial rectus is moving, causing the eye to move towards the right. So the two muscles that are working are right lateral rectus and left medial rectus, which are yoke muscles. So for the eye to move in that direction, both the right lateral rectus and the left medial rectus need to get equal innervation and simultaneous innervation from the brain. Then only the movement will be conjugate and they move together and they focus together. If it would have been not the case, then there would have been outshooting of one eye. The one eye will move more outwards, the other eye will move less, hence the person will find it difficult to get a binocular vision. This explains why the patients in the cranial nerve palsies get the double vision. Another law is Sherrington's law of reciprocal innervation. This is again very simple to understand. It says increased innervation to one extraocular muscle is accompanied by decreased innervation to its antagonist. That is, if one muscle is moving the eye in a particular direction, its antagonist, which moves the eye in opposite direction, needs to relax. So, say for example, if the medial rectus is contracting, that is, the medial rectus wants to move the eye inwards, its antagonist is lateral rectus, which moves the eye outwards. So, if the medial rectus contracts, that is, if it is getting an innervation to contract, then the reciprocal innervation, that is, the inhibitory impulse, needs to go to the lateral rectus of equal amount to relax, and it should not contract. In case if both contract, then the eye is not going to move. So when one muscle is getting an impulse to contract, the other has to get an equal amount of impulse to relax. That is Sherrington's law of reciprocal innervation. This presentation will form a very basic presentation for understanding all the squints, neuroophthalmology, and all related topics. So do try to understand all these terminologies and the various actions in understand the various pathological conditions better. Thanks a lot for listening and watching to the presentation. I do request you to share, subscribe, like, and comment on the presentations. Once again, thanks a lot.